Leptospirosis is a current topic which is relevant public health concern in the district at the moment also. So I would like to give an insight to the epidemiology of leptospirosis. So since this is the first lecture, I would like to say like leptospirosis, we know that it's a zoonotic disease. There are about over 200 serovars which are affecting both humans as well as the animals. Then the human transmission is associated with contacted with animal urine and urine contaminated with the environment. So we know when there are cuts and small injuries in the skin of people, these can get affected, these can enter the humans and cause the disease in the human. And also we know that human to human transmission is very rare. So when we consider about the clinical spectrum, we see very mild symptoms as well as lethal conditions. So it has a wide range of clinical symptoms also. And this is basically associated with heavy rainfall. The epidemics we see with the heavy rainfall seasons, and it is very important to identify the disease early and do the needful to prevent the disease spread. So when we consider about the global situation, leptospirosis is a significant global health concern, especially in the humid subtropics and tropical climates. There are about annually 500,000 cases which are being reported. Sometimes this is actually underreported most of the times. And annually there are about 50,000, they say around 50,000 deaths being reported worldwide. But this is also being, actually there are certain misclassifications and all those things. With that, there could be more numbers which we don't see properly. So regions like Sub-Saharan Africa, Latin America, Caribbean and the tropical regions are at high risk, especially the Sri Lankan region also is in high risk when we consider the global situation. When we see this map, we see the red hot zones, which we see the most highest abundant case numbers in the world. So we see now we stand at a point where we get leptospirosis throughout the year, although we see seasonal variations also time to time with the rainfall. When we consider the Sri Lankan situation, we are a hotspot. There's nothing to, all of us know we are a hotspot, and it had been there for a couple of, for the past decades, we have been seeing so many cases coming up, and especially the outbreaks are affected by the high humid seasons of the months. Then especially when we consider our area, we are at a moderate risk. Like Anuradhapura's North Central is at a moderate risk. Especially we get more numbers in areas like Ratnapura, Kegal, Kalutara, then the down south area, even Badulla area, we see many cases. Anuradhapura and Polonnaruwa is at moderate risk. Polonnaruwa is of course little less, we don't see many cases, of somewhere around 100 to 200 cases per year. Anuradhapura also, we see about 200 to 300 cases of leptospirosis annually in each year. So if I am to talk about number of cases starting from 2015 to 2023, you can see there had been rising numbers. For the past 4 years, it was somewhere around 8,000 to 7,000, something like that. This could be, you cannot see a increase in trend or decrease in trend or something like that. This could be sometimes even we are not properly notifying the number of cases also. So on average, it's about 8,000 cases per year. Also, this is the picture we see depending on the districts. So here you can see specifically Ratnapura, Gaul, Kalutara, those are the areas where the high number of cases are being reported, and Anuradhapura we are at a middle range, somewhere around 250, 300 every year. This is the monthly distribution of 2023 cases in Anuradhapura district. You can see there was a lot of cases reported in December, and specifically this, with the rainfall, the numbers are increasing most of the time. some of the we see the December we had a peak, and there was a lot of cases being reported at the hospital also. And also I will show the 2024 case load until yesterday's picture. So we see Anuradhapura over here. We have experienced more than 120 cases for this 1.5 months in this year also. Still, when you look at this, you see Ratnapura and Munaragala, all those areas experience more cases than Anuradhapura. So here I am going to show a little comparison compared to all the other communicable diseases along with lepto. So here we see last year the total number of all communicable diseases, we had about 2,335 cases. Out of that we had leptospirosis, you can see 281 cases. So compared to the other diseases, we have a lot leishmaniasis, and lepto is at leash is not life-threatening and it's a long-term disease. But when it comes to leptospirosis, we know although the case numbers are low, the disease burden is high. So when there was last year, in December, there was a death review with respect to leptospirosis, and we saw the extent of the disease, how severe it was, how the fatalities were. So although the numbers are less than the other compared to the other diseases, it is a much more public health concern when it comes to leptospirosis. Here, this is the distribution of MOHs. We have 23 MOHs including municipal council. So here we can see what are the major MOHs that we see the leptospirosis, especially Talava, Ipalogama, then Kabithikollava, Kabithikollava, Palagala, and those are the numbers with Nochiagama 24 cases, then Tambuttegama 22 cases, then Kahatakastigilya 25 cases. Likewise, we have hotspots. Those are basically sometimes it coincides with the fields, Pumuru, all the areas where the paddy fields are there, and where we see a lot of people are farmers who are being affected with the disease. So this had been the same for throughout the years, not only 2023, although this is only for 2023. Throughout the years, it had been the same. So here you can see I have compared two things. One is called notified count and the confirmed count. So as you all know, from the hospital, when there is a leptospirosis case being actually clinically on suspicion, you can notify the case. So when the notification is sent to the MOH team will go and do the field activities. So then they will confirm whether it's a leptospirosis case. They are not the ones who are making the confirmation. It's the hospital who is doing the confirmation. But on suspicion, the hospital staff is supposed to notify the case. So when the field investigation is going on, they will confirm it. So here there is a little bit of a discrepancy, like all the notified cases are not being confirmed because they might later on become a viral fever or something else, because that is the reason that we have a little bit of a discrepancy. Here, now when you consider the whole, the entire country, last year there were 8,054 cases being notified. Out of that, 6,299 were confirmed. So for each and every case, we will the MOH team will fill a form called special investigation form. We have a special investigation form. So earlier these were not very, it was not, the completion of these special forms were a little less. So, but last year it was about 75% we got the data from the special investigation. So I would like to give a little bit of insight regarding what epidemiological data we found from the special investigation forms from the entire country. When we consider, so out of the people, 84% are male. So we see it's a male dominant, like the people who are getting affected are mostly male people. And when we consider the age groups, you can see it's the working age group, specifically 20 to 60 years. The most productive people are the ones who get exposed to the disease also. That is because maybe they are the ones who go out and get involved with the field activities, cultivation and everything. So here, and when you consider the occupation, this is for the entire country, not only for Anuradhapura. You see, it's basically laborers, then farmers, little bit of gem miners, and some of the people have not filled the occupation because there were deficiencies in the special forms, also special investigation forms. So from the data which is available, we can see most were laborers and farmers who were involved with the disease. And the exposure, when we consider, 60% were paddy field exposed. They were exposed to paddy fields. So basically this is going through mice in paddy fields, and then comes marshy lands, then animal husbandry, and the other agricultural lands and wastewater sources. So epidemiology is there to find out what are the risk factors, who are the people are getting infected, and what preventive measures can we do. This is the study, epidemiology is involved. So this is the analysis that we can give regarding the leptospirosis risk factors. So when we consider the symptoms and signs also, from the special investigation form, we have gathered this also. We see 95% of the people had fever, then headache. Most common things were fever, headache and myalgia. The other clinical symptoms were little less and minor. So the other important thing which all of you think is like the prophylaxis use. So they say 65% they have not taken prophylaxis, and they have taken prophylaxis, that is 3%. So out of the people who were infected, out of the people that we gathered data, 65% said they didn't take prophylaxis, 3% said they took prophylaxis, and there was 31% which they said not known, like whether they took it or not. So we see in this picture, when we consider, most of the people have not taken prophylaxis, the ones who have got the disease. Here last December we discussed about the deaths, leptospirosis deaths. At the hospital, I think there were about 18 deaths or 17 deaths, if I'm to be exact, I guess. But there is a problem of death reporting to the national level. As I told you, like the notification form is there, but we don't get many deaths to the central level. Even the district level authorities are not being informed about there's a communication gap, because I think when the patient is admitted to the ICU, sometimes if they forget to send the notification form and the patient dies, then we don't know anything about the patient. So that happens. So I will just show you, this is very low numbers of deaths. I'm 100% sure if Anuradhapura had 15 deaths, 17 deaths, it cannot be 141 deaths throughout the island. Okay, that is grossly under-reporting. So the case fatality rate is also somewhere around 2. You know how to calculate case fatality rate, but last time when we discussed, case fatality rate was so high. It was about 8 to 10% something, just considering the TH Anuradhapura. So I think I'm not going to say much about this slide, because this data is little deviated, it's not the real data. So because of that, I'm not going to comment on that. And for that, they have actually done a corrective measure. This January, there was a guideline that all the deaths, it was there earlier also, all leptospirosis deaths have to be informed to the central level. Yeah? That means the epidemiology unit, by fax or by telephone on the day, by the institutional head. That guideline is here. I don't know, I think I shared it yesterday. Maybe we can share it later on, that guideline. There is a guideline saying that all the deaths have to be, leptospirosis deaths have to be informed to the epic unit via phone and fax on the day of the death. And there is a certain format to be filled, death format, leptospirosis death format to be filled by the head of the institution along with the consultant or the senior house officer who was involved with the management of the patient. So I think I have shared that. Maybe during the course of the, if you can share in another group, that I can show that form also. So considering all those facts, I would like to just highlight these points apart from the epidemiology. Prevention of leptospirosis. We should not forget the primary prevention part, primary prevention activities. We need this notifications from the hospitals as soon as possible. It went on, don't wait for the confirmation, just notify on suspicion, on clinical suspicion, so we are able to carry out the field activities. And also regarding the chemoprophylaxis, which is a very, everyone thinks, now I showed you a picture, one slide saying that only 3% have taken the chemoprophylaxis, but chemoprophylaxis we are supposed to give to high risk areas only. As a clinical, our guideline is like that. We have to select the places where there was previous cases. Suppose there is one field where there were a couple of cases coming, so we can give to those people who are working in that field only for a given time, like for 6 weeks we can give chemoprophylaxis. Other than that, we are not advocating blanket coverage of doxycycline, not to give each and every person haphazardly doxycycline. So I would like to emphasize that matter also. Just key points. I told you, notification from hospitals on clinical suspicion of leptospirosis is the key and early action at the field level by MO staff. Then notify from peripheral hospitals also. Since some of the people are from peripheral hospitals, don't wait until the patient is being transferred to the TH. And when the patient is being transferred to the TH, don't think that they will notify. If you are transferring a patient from the periphery, thinking this could be lepto, please notify at that point. So it is much more convenient for the MOH staff to carry out the activities. Then the death investigation form has to be filled and the deaths have to be communicated to the central level epidemiology unit as soon as possible. So those are the things, and this, I think, for this death investigation, everything, ICNOs and MO public health at the hospital would be, much of value if they are involved with these activities also. So thank you very much. I think I am within my time frame. Okay. Thank you very much. Okay.